Good morning, everybody. Thanks so much for making room. We have a lot of people here today. We are so very honored to have all of y'all here, and incredibly honored to have Dr. Itzhak Brook here to talk to us about medical and psychological challenges of life as a laryngectomy. So Dr. Brook has the unique experience of being both a physician and a patient who's had a laryngectomy. So he offers us really unique insight into both sides. So I know we have a lot of students here as well as a lot of patients who've had laryngectomies, and so I think it'll offer us all a lot of new information and new ways to think about our patients and our doctors. So Dr. Brook is an adjunct professor of pediatrics at Georgetown University in Washington, D.C. His specialization is in infectious disease, and in that area he's actually done extensive research and authored 6 medical textbooks, 128 book chapters, and over 700 scientific publications. So he's an editor, associate editor, and member of the editorial board of several medical journals, and the Head and Neck Cancer Alliance. He was the recipient of the 2012 J. Connolly Medical Ethics Award by the American Academy of Otolaryngology Head and Neck Surgery. He's a huge patient advocate for improving care and has produced some different videos for he's produced a book for patients as well as some videos for medical professionals on how to provide improved life-saving support for patients who've had laryngectomies. So without further ado, I'd like to invite Dr. Brook up, and we are so thankful to have you today, Dr. Brook. Thank you.
Good morning. It's a pleasure to be here today and talk to you about the life challenges as a laryngectomy. As you can appreciate, I'm a laryngectomy as well. I became a laryngectomy about 5 years ago, seeing a dentist, a dental hygienist at least, every few months. I go to my dental hygienist once every 3 months. And it's a good investment because it will keep you from having more serious problems. Thyroid is usually affected, and we need to get replacement treatment. Replacement can change with time. As we age, we need less. If you have illness or you gain weight, you may need more. So it's important to monitor it, especially if you feel very tired or weak. I think it's best to do it at least once a year. The blood test that they do. Stiffness of the muscles of the neck is an ongoing problem. It can cause you difficulty to move your head. It can make it difficult to drive. It can give you shoulder problem. It can give headaches. So getting physical therapy is important. And the physical therapist can teach you exercises that you may need to do every day through your life. I do it, and if I don't do it, my neck gets stiff. So it's important to do it on a continuous basis. Lymphedema, swelling. Fortunately, it does get better over time, but there are exercises that you can learn and massage that you can get from a lymphedema specialist, and then you can learn to do it yourself. It's essentially massaging the area, and it does get down. I had tremendous lymphedema, still have a little bit left, but I still do massage of the face and the neck and under the chin, and it does get better. One of the problems that we may see 7 to 10 years after the radiation is damage to the carotid artery. The neck is a very, very important intersection in the body. Things go down to the body from the brain, and things go up. What goes up is the blood to the brain through very big arteries. They're called the carotid arteries. Radiation to them, damage them, and it takes time for the damage to become evident. Usually what people start feeling is dizziness, lightheadedness, and to fix it is very, very simple and easy. They put a stent, a tube inside the artery, and it's like new, but you need to detect it. It's a very easy test. It's called ultrasound of the neck. It takes about 10 minutes, doesn't hurt. And then you are able to know if you have it or you don't. Blood pressure too may be affected. Blood pressure can become very high and sometimes very us annoying. Other people may get problems in the feelings and the nerves of their shoulder and their arm because radiation can cause cancer. We need to watch for cancer in and around the neck. This is why it's good to see a dermatologist at least once, if not twice a year. And they should know you got radiation because the area around the neck can develop skin cancer sometimes. Very easy to treat, but you need to watch for it. So here are some of the problems we need to watch. Surgery can also cause problems. Swallowing is an issue. Deformity. We really don't really look the same. And then we lose sensation because when they cut the lymph glands out during the surgery, they also remove the nerves. And that is why we need to be careful, men, when we shave, not to cut ourselves. I use an electrical razor to do it. And then we need to be aware that when it's very cold, we need to protect our neck because we won't feel it like we used to do. Cold air is a big issue. It's sometimes difficult to breathe well in cold air. And cold air doesn't have a lot of humidity. So it's a different issue we have to deal with. I won't go into swallowing, but swallowing is something that can interfere with eating good diet. So you need to get it better. Your physical therapists and especially speech pathologists are trained to help you. There are exercises, devices, and training, and even procedures such as dilating the esophagus that becomes narrow. And that thing needs to sometimes be done every few months to make it still, the esophagus, to make it still work as it did before. One thing we need to remember is never forget that we have other problems. And unfortunately, as we age, we have more problems. Do not only concentrate on your cancer. It's important, but not enough. You need to worry about medical issues like this, diabetes if you have it, lung, heart, and other issues. Maintain good nutrition, because without good nutrition, you won't be healthy to keep well. And of course, any other problem that may arrive, don't neglect it. We need to also do preventive medicine. Go to the dentist, as I said. Get annual, and if needed, more often, examination. And be followed up by an otolaryngologist. And as time goes by, you need to see them less often. In the beginning, maybe every month, then every 2 and every 3 and every 6, and that's once a year. You should, once you get to 5 years and longer, most people believe that an annual exam is enough. But if at any time you feel something new, symptoms, pain, that doesn't go away within a few days, suspicious in the neck or mouth, by all means see the otolaryngologist sooner. Diet is very, very important. And then, because we age, we need to eat more protein and less sugar. One issue we have is we need to drink a lot in order to swallow. Well, it's important to drink, but sometimes drinking too much carbonated sugars or salty things like soups can bring burden on your blood system and actually make you have hypertension more than you should. It can keep you up at night needing to urinate, so you don't get good night's sleep. So you need to find a balance of how much to drink and what to drink. But definitely, drinking enough is important to keep the moisture in the lungs in a good state. Otolaryngologists are your primary person to take care of the cancer. And of course, CT and MRI and PET scan are important. But remember, all those scans are not perfect. I had my recurrence, and my PET scan, CT and MRI were negative, but the doctor saw it when he examined me. There is no substitute to examination. And if you need to make a decision about your treatment, you should of course listen to what your doctor tells you. But if it's a big decision, don't be shy about getting a second opinion. Second opinion is very, very useful. It can give you a different perspective. Everything in medicine is not one opinion. There's usually other ways in most times to approach a problem. And if you have any doubts or questions, do ask for a referral for a second opinion. Psychological issue is very, very critical. It's very stressful to have cancer, especially cancer of the neck, because it affects the way we look, the way we speak, the way we eat. And we are dealing also with uncertainty of the future. Am I really cured? Obviously, the farther away you are from the diagnosis, the less likely you'll have a failure and recurrence. Most recurrences happen in the first 2 years, and after 5 years, it's really negligible, but not completely over. So we are afraid. Initially, I used to worry about everything. I still do, but I don't run to the doctor every time. Learn to wait a couple of days, and usually 90% of what I feel goes away. But we still worry about it. We worry about how people perceive us. Do they feel sorry for us? Are we deformed? Hey, will people and friends stay with us? All those things are things that are really a burden on us. And depression is sometimes I speak through a voice prosthesis, but there is an electrolarynx. There is esophageal speech. You can also communicate by other means like writing or silent articulation. Although things are important, they may not be cheap, like supplies may not be inexpensive. Those of us who are veterans can get support and supply from the VA. I do. But even Medicare would cover some of the supplies in the electrolarynx. In some of the states, I don't know about Louisiana, but some states do provide help. One unfortunate thing is that many people who are laryngectomies, when they need emergency care, meet health providers who do not know how to do it. I was shocked when I went to the emergency room and needed oxygen. They gave me to the nose. Now I could speak because I had to take my HME cover off. But it took me 5 minutes to explain to them they need to give it here. Every year, people in this country, about 20 people a year, get damaged because of this. You need to tell the local EMTs in your area, the emergency room of your hospital, about your condition. I prepared a video that shows how to do it, that is available. I will show you a copy at the end, but it's freely available, and Atos gives it free, and I'm sure your club will be able to get copies of it, so you can show it to your fire station, an emergency room, and when you need a procedure, like colonoscopy or anesthesia, show it to the doctor. I have a blog website that has this video on YouTube, so everybody can watch it and really benefit. Well, the main reason that laryngectomies need emergency respiratory care is mucus plug. You can prevent it by keeping the trachea wet
I was hoping to find one that we could pass around to everybody. Does anyone have any questions for Dr. Brook? Don't be shy. I know we covered a lot of information today, and we are so grateful for his expertise on both sides of the quarter. Just to remind you, he spoke a lot about being a neck breather and emergency preparedness. And as most of y'all know, we created these bracelets that say, alert neck breather. And that's something that you can, we encourage everyone to wear all the time, because you never know if you're going to be in a car accident. You never know if there's going to be a situation where you're not going to be able to communicate, hey, I need that oxygen to go to my throat. So if you don't have one of those bracelets, certainly come by and let us know, and we will get you some. And then this is the card that Dr. Brook keeps. You had it in your wallet?
With the medication and my doctors.
And we have some of those as well. If you don't have a pocket card, that's great too. And I think they actually make decals that you can stick on your car that says, alert someone in this vehicle breathes, from their neck. So make sure that you check. We always encourage our EMS personnel here to check the neck. So certainly come by and get a bracelet from us if you don't already have a bracelet. Are you sure no one has any other questions? Oh, we got one back there.
Did you have a problem with flame congestion?
Yeah, mucus is coming all the time, but it gets better over time. One thing that prevents it from happening is wearing an HME. When I wear it 24 hours. I wear it at night. And this way, after a week or two of wearing it, I've less and less mucus. But still, I need to cough out a couple of times a day to clean it. But it really gets better over time. And I can tell all new laryngectomees, things are going to get better with time. The first year is difficult, but you get better over time. Sometimes people forget to tell you this. You should know it.
Your voice to me sounds like a whisper, a loud whisper. Will your voice change?
No, it won't. And that's because they placed instead of my larynx a skin flap. They recreated it from a flap from my arm. And this flap is very weak. It's flabby. It doesn't have a tone to it. So my voice is weak. But that's what I have. And I learned to live with it.
And he expects different.
Why don't we there's a big variety of different voices after T puncture. Maybe our front row can all say hello. Will y'all just say hello, starting with Mr. Gilmer?
Good idea. If you want to come up to the mic, so just so people know what type of voices.
Our movie stars
So,
today.
like Dr. Brooks said, different people respond differently to radiation, have different methods of reconstruction, and so it doesn't vibrate the same way in everyone, but you'll see how everyone's.
She does that to us. Yeah, some voice, mine is up and down, but it's okay.
So you can see the difference between Dr. Brooks and.
Yeah, I'm about 3, almost 4 years now. And so I talk very, very plainly. That I feel, lot different from Dr. Brooks.
Everybody's very different.
Hello, I will be 8 years in September. My only complaint is when I'm talking on the phone to someone I don't know, they think they're talking to a female. Me too. They do it that way.
But I mean, I think, it's important to know that a lot of them, Mr. Gilmer, took a few months to get to the speech he had. So there's a lot of working with it. How about electrolarynx speech? Do we have...
Mr. Olivier, would you say?
Mr. Olivier, do you want to come up and...
Come on up.
And so that's the first method of not reconstructing the voice. Yeah, till we do the T puncture.
Your battery. Sorry.
I had review on me.
But luckily he's got both methods, or two of the methods.
But another thing, just like Dr. Brooks goes around giving speeches, I think one message we want to get across is people go back to jobs. Mr. Long here has his own business. Mr. Gilmore, all of them here have their own businesses, are speaking. So having a laryngectomy is life-changing, but definitely life goes on for everybody. And
Was there a question in the very back?
I just want to show you the video that you can get that explains about resuscitation. So if you have it, you can bring it when you go to Europe, an anesthetist or a people that take care of you, so they know how to resuscitate you.
And I think Rob may have, Rob, do you have any of those in the back?
I do have some.
Okay, he's got a couple, and we could probably get a couple more at our next meeting. Question in the very back.
Okay, my grandmother said she had a surgery in '92, and her speech was all right. It was pretty good, but she had a stroke about 2 to 3 years ago, and she said it got bad. She wants to know if there's anything she can do to improve this.
so what happens in some people is when you have that scope, there's swelling from the scope, and then that's followed by scar tissue. And so the only thing that can be done is dilations to try to increase that swelling. But unfortunately, everyone's body is different and tends to scar back, and that's why those dilations have to be repeated. But one of the things Dr. Brooks mentions, which is why he has that CD, is physicians, EMTs don't seem to realize that once you have a laryngectomy, if you have to be resuscitated, they've got to have you breathe through the neck, put the tube in here. There have been so many incidents where they try to put the tube in still through the mouth. And so it would be good for our support group maybe to take this on as a project to educate EMTs around the city. There was a recent episode of a patient from Willis Knighton who died at Brookshires only about 6 months ago because he was intubated through the mouth and there's no connection. So we would think that even the medical people would know, but it's a hard concept because a tracheostomy, many people have a tracheostomy, and for that you can put the tube in from the top because a tracheostomy is just making a hole, not an absolute disconnect. So if this support group wants to take that on as a project to educate people in the Shreveport Motion area, I think it's a good one.
Actually, my two sons are paramedics in Boulder Parish.
That would be
With the
awesome.
marriage,
Maybe
and
we
they
can get
both
them
know all
involved
they
in
know.
Maybe they can help us out. Get the word out. Okay, I think, did you have a question?
I was going to ask Dr. Brooks, how important do you feel is for free counseling for our laryngectomy patients?
I didn't talk today about counseling before, but it's very, very important. You need, I think one of the things that the support group should do is visit people when they come to the clinic before the surgery and show surgery, and they became immediately a very important support group to me. So I think it's very important.
I also think the caretaker should have the pre-counseling also.
Absolutely.
Very important.
I should have mentioned it. But being a caretaker of anybody, especially a laryngectomy, is a big, difficult job. We cannot communicate as well. And because we may be isolated, we take a lot of our frustration and anger at our caretakers, whether it's children or spouse, and they need help too, which may include counseling too. And counseling together is very important. I have information about it on my blog. Don't neglect the caretaker. It's sometimes more difficult to be a caretaker than a patient. Yes.
Yes, sir. Could you expound some more for me about being in the workplace? What do I need to do as far as my employers are concerned about my disability? I have a disability, but I'm not disabled by any means. What can I do?
The question was about disability in workplace. I think that you are protected by the law, that's first of all, but there can still be discrimination. I hope that your employer is considerate and sensitive and realizes that you have qualification, experience and sensitivity that outweigh any disability you have. So I think many employers do accommodate people who have laryngectomy, and they end up having a career as before. But it's not easy. I know it's not easy to speak, even if you speak well. And many people don't understand or appreciate it. One thing I learned is that I learned to economize in my words. So I think twice before I speak. I speak more to the point, because I know there are X numbers of words I can say before I would be tired or I would be breaking the seal. So it really makes us much more calculated than planning people.
Can you go all day without breaking the seal?
I'm lucky if I can give a lecture for more than 40 minutes without breaking the seal. But if I don't give a lecture, I don't break the seal. But I'm still learning to speak without breaking the seal. The clue is to speak softly, slowly, and take a breath after about 4 to 5 words.
What about when you think you're going to sneeze or cough? What do you do?
You need to take it off quickly. And if you don't, you need to have a replacement. We've become pretty good over time. I'll probably have an accident once a week. But otherwise, I think we learn how to do it. Also, I sneeze less because I don't breathe from my nose anymore. regular HME. And I speak with it too, but my voice is not as strong without an HME. So I like them HME, but I always carry this one in case I break the seal. I never know when it will happen. Then I speak like this, but my voice is not as good.
So just to elaborate a little bit more on that, different people use different things to either cover